Okay. Should be good.
Good afternoon, everyone. It is 12:53, and I'd like to call the meeting to order. Rakisha, would you mind doing the roll call?
Not a problem. Good morning. Good afternoon. Dr. Beravecchia. Mr. Bennett,
Here.
Mr. Billy. Ms. Crane. Here. Ms. Hayden. Here. Ms. Hayner. Here. Ms. Harmon. Ms. Kelly Dooley. Here. Ms. Nguyen. I didn't have to unmute as well.
Did you say Pascal?
Yeah.
Oh, yeah, I'm here, you guys.
Mr. Rocca
Here.
and Ms. Lee. You have a.
Thank you, Rakisha. Before we get started, I just want to remind you all of a few rules. For committee members and members of the public attending in person, please raise your hand to speak and wait to be recognized by the chair before speaking. To help the meeting run smoothly, please keep side conversations to a minimum and comments related to the topic we are discussing. For those committee members who are attending virtually, remember, you must be on camera and have your first and last name going to be counted towards our quorum. Please keep microphones muted unless called upon by the chair. Electronically raise your hand to request to speak and wait to be called on by the chair. For attendees, electronically raise your hand to speak or to request to speak. Once recognized by the chair, your microphone will be turned on. After speaking, the microphone will be returned to mute. Also, the Q&A is to be used by those needing an ADA accommodation to participate in the meeting. Public comment will not be accepted via the Q&A except for those individuals who requested the accommodation. As for order, committee members in person and virtually will be allowed to speak first. Public members in person will then be called on, followed by public participating virtually who have raised their hands. Comments in the Q&A will be addressed last. As with all hybrid meetings, it can be difficult to keep track of those wanting to speak in person and virtually. Please be patient. All comments and questions from the public may be limited to 2 minutes at the chair's discretion, so please keep that in mind. Depending on time constraints, we may also limit comments to once per issue. Also, comments about a person's character will not be allowed. Finally, members of the public will have the opportunity to provide public comment before each vote and during designated public comment periods. The chair may also use their discretion to determine if comments will be accepted outside of those times. Everyone should have reviewed the January meeting summary, which was attached in the agenda you received via email. There's also a copy in your committee packet. I need a motion to adopt the January meeting summary.
Oh, well. I have a correction.
Okay.
On the members present, my last name's spelled wrong. It speaks on one, but not the other. That's it.
Well,
Okay,
Thank you.
so, Jill, do you wanna make a motion?
I will make a motion to approve the January meeting summary.
Is there a second?
I'll second it.
Who?
Sure, go, it's fine.
Oh, sorry,
It's
okay,
fine, Sherry's.
okay. Sherry Crane. Seconds. Is there any discussion? Any public comment? Okay, we will now do a roll call vote. Rakisha, can you please call the roll?
Dr. Beravecchia. Mr. Bennett.
Approved.
Mr. Bennett is a yay. Mr. Billings. Ms. Crane.
Yes.
Ms. Crane is a yay. Ms. Hayno.
Yes,
Ms. Hayno is yes. Ms. Hagan.
yes,
Hayno is yes. Ms. Hagan is yes. Ms. Harmon. Ms. Kelly Dooley.
Yes.
Ms. Kelly Dooley is yes. Ms. Nguyen.
Yes.
Ms. Nguyen is yes. Mr. Rocca.
Yes.
Mr. Rocca is yes, and Ms. Sue.
Yes.
Ms. Sue is yes.
Thank you. The motion to accept the January meeting summary has passed by unanimous vote,
8 yes.
8 yeses. Okay. Now we can turn things over to Julie Foster Hagan from OCDD, who will share with us updates from the department. Julie, the floor is yours.
All right, and I also invite others that are here from the Department of Health to chime in if there's updates they would like to have. But first off, I just want to say, we had, in this meeting, we had been sending sort of a separate report from time to time. And then we also had our report for the full council meeting. We've done some updates to the report itself. Jill was happy to see that it was shorter, but we tried to simplify the data that we have in our report, remove some things that just were kind of the same thing that was being repeated over and over again, and then add sort of a hot topic. So a lot of times what we would talk about in here were more some of the kind of hot topic kind of things. So it looks different. And so as folks review that, happy, whether we do it now or whether we do it, next meeting, or you guys can send information to the council staff and they can let me know. If there's things that we maybe missed that you guys wanted. What we found is, like, over time, people might ask us for something and then it showed up, and 5 years later, we're still doing it, but nobody's even paying attention to it anymore. But we don't want to take anything away or not be transparent. So if there's something you would like to see included in the report that's not included in the report, please feel free to let me know, and we'll make sure that we update that. Understand that there are a lot of questions about the state. I'll start with the state budget and then talk a little about the federal budget. And that's why I invite others to chime in for their programs, because my remarks will focus mostly on OCDD. Right now the budget is being, going through the process of the legislative session. There's been some confusion. So for the most part, the services that we have in OCDD, so our home and community-based waiver services, the ICF services, the different funding for the services people get are pretty much standstill for us. So there's not any increases, but there's also not any decreases or cuts. We were asked by Governor Landry, almost one of the first things he did is ask us to start looking at efficiencies. And if there are ways that we can reduce the state general fund for certain activities. So there have been some activities specific to OCDD that have been eliminated. And then an additional thing I'll talk about, and Gary may want to contribute as well for OAAS. But we did have, in the Early Steps program, we had contracts. We had 10 contracts for what's called community outreach specialists. And those, a lot of those were with families, health and family centers, but not all of them were. And one of the efficiencies or reductions that happened is that those contracts weren't going to be renewed. They were scheduled to end in June 30th. And so the decision was made not to renew those contracts starting July 1. And outreach and things that those community outreach specialists were doing will be assumed by some of our Early Step staff now. Another efficiency that was discussed during public testimony is there was a contract with the Arc of Louisiana, and that contract with the Arc of Louisiana helped to fund the organization People First. It was about $110,000 for that, with a focus on training self-advocates, and they had regional People First meetings and some state People First meetings. And that contract was also eliminated as part of the efficiency exercise. The other thing you'll see in our OCDD budget is that when you do Medicaid work, Medicaid does have an allowance that you can draw down what they call 50% administrative match. So that means like, if, for my staff, for example, who work on Medicaid, they're working Medicaid stuff. So technically, instead of 100% of the salaries coming from state general fund, there is an ability to ask Medicaid to pay 50%. So 50% would be state general fund, 50% would come then from from CMS or from the federal government to draw that match down. We were getting that match for some employees in OCDD. And again, Gary may want to talk about that on the OAS side, but we weren't getting it for all of the employees who would have potentially qualified to get that match. So it looks like our budget is reduced in state general fund, but it's not really reduced. It's just that instead of needing 100% of state general fund for certain positions, in this budget, we're only asking for 50% state general fund. Then we're gonna ask CMS to draw down the other 50%. So that was about 4.2 million, because I've gotten some questions about that. Where did that 4.2 million come from? And again, it's not a reduction, it's just maximizing the use of federal funds. And Gary, I defer to you if you want to add.
I agree. Yeah, we had the same thing. You'll see a reduction. It's not really as Julie mentioned, a reduction in services. We had about $8.2 million that will have less in state general fund. But as Julie was alluding to, we just found that those staff, by virtue of their duties that they will be performing, that those staff member salaries and related benefits qualify for the Medicaid match. So you'll see the reduction in state general fund, but an increase in the IAT, because we'll draw those funds from Medicaid for those staff member salaries by virtue of the work or duties that they're responsible for performing. Like Julie mentioned, we are, as far as services go, there's no decreased funding associated with services for OAS. We are continuing to look to use American Rescue Plan Act dollars to provide training opportunities for technical assistance for partners, as well as any providers that work with our participants.
Okay.
Yes, Brenton.
Just a question. I know in executive committee, we talked about it. And we push alerts about, if there's a Medicaid cut at the federal level, will that impact any of the staffing? So if they're getting paid through Medicaid dollars, you now move the state funding that could pay the other half of their salary. If that is cut, do we know if there's a plan if something like that would happen? Like, does that mean staff position eliminations or?
Hopefully not. So when we put that up as an efficiency, it was prior to January.
Gotcha.
And so it got put, because we start the budget, like as soon as we know what our budget is in June, we're starting for the next year in July. And so when we looked at those efficiencies and we talked about doing that, it was before there was discussion at the federal level. So I've asked if there's a plan B, and I've been advised the plan B would be that we'd have to go ask for those state general fund dollars, but there's not a plan for eliminating the positions. We would have to go then and request those state funds to fully cover.
Then anything that was eliminated for efficiency purposes, so let's say the COS contracts or People First, if folks advocate, does advocating for dollars for those help, or is this eliminated because it's just an efficiency? We don't think it should happen whether the funding is there or not. I just don't know how efficiency and advocacy and dollars can tie into those things if people wanted to advocate to try to get that back.
Sure. So, when the efficiencies were determined, and I think if you watched the public testimony, there was kind of a question of who did this? Well, there's not like a person to point to say who did this. During the efficiency exercise for LDH and for all states, like we had tons of templates and things we had to list every single contract we had and hundreds of questions about the contracts and thinking about different things. For every expenditure that we had, each of us had to do like a deep dive into it and look at things. And then the Department of Health executive team looked at things. I had that question come to me, and basically if the, you know, if the community or anyone from the public, and whether that be those that you mentioned or other efficiencies, if the public disagrees that those are efficiencies, that in fact those programs are needed, and they go and advocate for it, and the legislature does a line item for that item, then yes, we will reinstate, you know, again, with that funding that we would need added back from the legislature. Brian, I don't know if there's anything you want to add about that, but.
Yeah, I just didn't know if it was more of a targeted, like, administrative advocacy, like target LDH versus does it need to be a funding component attached? Just for the people that do ask, I wasn't clear what direction to give them. Do you go to the legislature, or is this more trying to reach out to LDH leadership?
So because, yeah, well, because they're in the budget as a reduction, LDH, like reaching out to LDH would be difficult at this point because we don't have the funding in.
Gotcha.
Like even if we said, okay.
So still the
but
legislative,
we
right?
still need the funding to be able to reinstate any of the ones that were reduced or eliminated. Because the state general fund tied to the activity is now gone.
Gotcha.
Also had a lot of questions. There's, you know, there is some advocacy we know right now around some different activities. You know, you guys restoring the funding for the Families Helping Families through the Developmental Disabilities Council. Our provider network have asked that we, and we provided the information there, you know, right now in home and community-based waivers, if you are a person who needs assistance with medication administration, there's some requirements that there be a nurse who can train the direct support professional how to give you those medications. But we don't really have a way to reimburse providers for doing that. So they just have to figure out how to do it in the rate that they get, regardless of if people need that assistance from a nurse or not. That's one example. There's some other examples where it would be helpful to have a nurse consultation. So they've asked us to figure out, we used to have a code that providers would be able to bill for a nursing consultation. At that point in time, or 10 years ago, no one was billing for that. They weren't using that code. And what happens is if you have a service on the list that you're not using, CMS says, why are you doing that? You need to take that off. So because the service was there but not used, it was removed. So they're kind of asking us to turn it back on. And so if the funding is there, that's something we're looking at. What would we need to do in terms of would we need a waiver amendment, or we have to add that as a service definition? It would have some caps to it. So, but we're working on that. That's one area we know they're trying to get additional funding for. The other, and I think the council had a part of, there was a resolution that was done a couple of years ago that asked us to look at for support coordination services, the time it takes from when a person is, quote, linked to services, which means you get the letter in the mail saying congratulations, here's your waiver offer, to certification, which means you're actually receiving services. And right now, when the work that the support coordinator does on that, they don't get paid for. They don't start getting paid until the person is certified, and then they can bill monthly after that. So what they asked us to do is look at the ability to have some kind of a payment for support coordinators for that linkage to certification work. So there is a report, HR 209 of the, I think it's the 2023 legislative session, that gives all the examples there of recommendations and different things. Where we landed with the group is that at the time a person is certified, that there could be a payment then to the support coordination agency, just like a one-time payment only for your initial plan of care that would then cover the work done. Of course, there's a fiscal impact tied to that. We've shared that. So we do know that there's some advocacy to try to add that service as well. In terms of the budget, there is, you know, will that be added? Will it not? We don't know. in the hands of the legislature. And I've had a lot of questions around with the constitutional amendment not passing, what does that mean for the budget? Does that mean we're looking at cuts, or does it mean, and to be honest, you can ask 100 people right now and all 100 of them will give you a different answer. So until we meet until the revenue estimating conference, and the revenue estimating conference is a group of economists who take a look at the money that's coming in, all the rules, all the laws, you know, some things changed during the special legislative session about our tax dollars. They usually meet around May. We don't know the date yet, but until they meet, what the House is having to do with the budget is just make assumptions that we have X amount of dollars based on the last time revenue estimating conference met. Then in May, that's when they'll really be able to say, what are the effects of all of these changes that have happened? And we'll have a better idea of the estimate of state dollars they anticipate coming in, so that then we know. So based on that, what will happen is then the legislators will then have to look and say, okay, did that change? Did that change substantially? Is it about the same? Did it go up? Did it go down? If it goes down, that's when we have to look at where are we going to reduce the budget. If it goes up, that's when you start seeing that they get other things added. So maybe then they could say, like right now where the budget is, there's not the money to add I don't know what's going on with families helping families, but like the nursing and all that, it's not added in the budget right now. But if they know there's extra money, then those are the kinds of things that they can start thinking about adding back, or adding into the budget request. So it's still very uncertain, unfortunately, right now, until they have that revenue estimating conference about what some of those things might look like. And that's just on the DD side. I know there's some advocates advocating to get more community choices waiver on the OAAS side. I'm sure there's other requests happening on the Medicaid side, but I know there's a lot of different requests in the behavioral health realm. Again, then it's in the hands of the legislators and the advocates to help the legislators understand what's important to our Louisiana citizens get considered. I don't know if that's clear or not. It's uncertain, but just trying to help explain sort of where we are in the process, but happy to take questions or if there's anything.
The only thing I'll add is just to add a little bit more uncertainty on the federal level. I know that they are, I think, going to begin meeting in May to kind of look at the budget on the federal level, which may or may impact some changes to Medicaid. So we haven't heard anything definitively yet on that because those discussions haven't happened. But I do expect that maybe within the next month or so, we might get a clearer picture on, you know, what that will look like and if there will be any changes to Medicaid.
Yes, Evan.
So Brian, my question is for you. Because like Brenton said, we did like have a lengthy discussion in the executive committee about Medicaid and on the federal level. And of course, the leaked budget that was leaked and basically eliminating the state council and everything. So we're having to come up with contingency plans for our national organization to share. And so I'm wondering if there are changes, is Louisiana Medicaid, are you guys coming up with contingency plans just based on if the FMAP is cut, or if you guys go to block grants or per capita caps? So I'm just kind of wondering.
So we have our national organization, the National Association of Medicaid Directors. They have been talking to all the states about that, and they do have kind of a resource guide of all the changes that are on the table, I guess, right now. And at this point, I don't think we've done, at least I'm not aware of any projections that we've done, because we just don't know what's going to happen. I mean, it would just be a guessing game at this point. But like I said, maybe after this month, we'll have a clearer picture of what they're considering, and then we will start putting those projections together.
And follow-up question, would y'all share those projections? Or is that more of an internal?
We would definitely share them with the legislature because we would have to, so they would be available, in that way, but, depending on, I guess, the scope, we would have discussions with the legislature concerning the budget, yeah.
Thank you.
You're welcome.
Yeah,
Jill, did you have anything?
No,
yes.
that has nothing to do with nothing, but it pops in my head and you would do the answer more than most. Would that waiver cover doorbell camera, doorbell camera?
Possibly.
Because Nike's worker, like, we were in the midst of talking about it, and then she got a promotion in the new case worker number. We have been talked about it, one of the lady, and I know who's like coming over, but still.
I think, I just texted somebody, I'm waiting on the answer. So, yes, it would be, if it's a necessary service, and you talk about it with your support coordinator and put. I mean, so it's part of the, we talked about it in here before, we have some new technology services available in the waiver that are around smart technology, that's why I thought it would be. So talking to your case manager about it is absolutely correct, and if it's included in the plan and something that helps you be more independent, feel safer in your home, then yes, that is something that, can be covered.
Yes, Eric.
My concern is basically whether we have to really, first of all, y'all still trying to put the waiver as one.
Eventually,
My second concern is with all the cuts, how much concern do we have to worry about with the waiver? Where is it now?
that's just so hard to answer. I wish I had a better answer. I don't want my answer to scare people. But I also don't want my answer to make people feel like, oh, everything's good and I don't have anything to worry about. So I would say I would be really paying attention, keep asking me those questions, keep asking Brian and Gary those questions. Make sure that we're telling you what we're hearing. I don't know. I actually was invited to go. I'll be in DC May 12th and 13th with a group of other DD directors and aging directors, educating some of the federal legislators on what is important about developmental disability services, our services, the council, kind of the gamut of the DD system. I'm working with Ebony and Brenton to kind of get some information to help me with some talking points. At this point, all we can do is focus on education, like legislators, state legislators, federal legislators, they need to hear from all of us about how important our service system is.
But if you don't have a disability, you can't talk about something that you don't have. We have it. This is our life.
That's what I'm saying, you need to advocate, let them hear your story.
That's just the concern that we all on the same page. Is it something that, like you're saying, so I wanna know if it's something we have to really work about.
Again, I think any advocacy anybody can do is helpful. From the state level perspective, with where the budget is now, I think you're fine. I don't think we're getting any increases, but we'll see about the two I mentioned, but there's no discussion. We're not at a point at the state level where it's like the programs are at risk of not being there. At the federal level, I think it really just depends. Now, just so you do know, some of the numbers that are in the news right now are kind of scary at how big they are. But most of those are over a 10-year period. So they're not trying to cut it in like 1 year. So you may see that whatever they decide looks not as scary year one, but maybe gets more scary as you go along. But at least to me, it's the unknown, right? The scariest part right now is the unknown, and we just don't know. Like I said, I can't really say how much. I think everybody should be a little worried, but I don't think you should lose sleep at night yet. It's not ready for that. And I think everybody should be thinking about, as I said, how do we all collectively make sure that anybody who's making these decisions understands the importance of the services that and the story. It's like not just for you, it's how do the services impact you in your daily life? And for me, it's how do I make sure people understand that I'm, in some ways trying to speak based on the story that I hear from you guys. So just as much education and informing, I never really paid attention at the federal level. So I don't really know all of the people that are on all of the committees at the federal level, but even knowing that, writing letters, I know we do a lot of advocacy here at the state level. It might be time to think about, maybe you guys already have, but finding out who are on those main finance committees at the federal level. Tell them your story. I can say that hearing your story is powerful to folks that are making decisions, and it makes a difference. Did you have a question for everyone?
And I was just gonna chime in more, but you covered most of it. I do think certainly sign up for council and Lacan information, because we do try to share all that information. But there's tons of disability groups out there that are sharing action alerts and information, and some of those groups can actually share things that we can't, where they might tell you specifically what you should be asking for, or that certain groups can lobby, we can't lobby, so we can't give you the specifics of exactly what you should do. But there's a lot of groups out there, state level and federal level, that are asking for a lot of different things and trying to communicate what's going on and what the possibilities of cuts, no cuts, what could happen. So I just encourage everyone to sign up for any group you could think of, to advocate in any way that you could think of. Like Julie said, I haven't myself heard a lot about services necessarily being cut at the state level. I have had very concerning conversations about anything new you want to get, any dollars you're asking for this year, we pretty much point blank been told you're not getting it. So that impacts, at least from a council standpoint, our FHF dollars requests. But again, the more you can share your story, the more you get out there from the people. When we have Yellow Shirt Days, come out. When other groups have days, go to their Capitol Days, go to their rallies, and really try to get out there and just speak to whoever will listen. It's a big thing.
It really does make a difference. When you watch the House Appropriations and the Senate Finance, I always get picked on because I'm usually the only assistant secretary who has to go to the table and answer questions. That's a result of your advocacy. The legislators want to ask me a question specifically because they know that they've gotten phone calls and letters from people about developmental disabilities, and they want me to have to respond to that. And so it makes a difference.
I just say I'm good, but my friend Julie's better.
I also had a question. We do have a new secretary for the Louisiana Department of Health who started, was it just last week? Just had us on our toes. There was a press conference that he was able to kind of talk about some of his priorities. We have started having senior management level teams with him, and he is very interested in kind of learning more about our day-to-day. So each of our sections has, next week, we'll do briefings with him where we have to share sort of, what are the services, what do we do, what are our main priorities? And so he wants to meet with our team so that he can really dive into that. There was a question around kind of what are his areas of focus, and publicly so far, he's talked a lot about, there's now, they implemented something called Project Mom that's around maternal overdose mortality. They are also, started a fraud, waste and abuse task force, to take a look at things that would fall into those categories. And he's looking at reforming the Medicaid pharmacy benefits management, or PBM. So I know those are the three main priorities, but he's also continued to talk about, behavioral health. And when he talked about behavioral health, he's talked about the interconnectedness of it. So I don't think, a lot of times people talk about behavioral health and they forget that behavioral health also means people with intellectual and developmental disabilities and co-occurring behavioral or mental health issues. And so, he's talking about how all of those things overlap. And then refocusing a lot on chronic disease, which we know a lot of times folks with intellectual and developmental disabilities are disproportionately affected by things like different types of chronic disease. And so taking a look at those. So again, only a week on the job, but those are already some of the priorities that he's laid out. And I'm happy to, continue to provide updates with that. But I don't know if there's any other specific questions around that. And then the last thing that I was asked to kind of talk about was House Bill 559 by Representative Eccles. That was heard in House Health and Welfare yesterday. It was a pretty lengthy conversation. Basically, what the bill in its current posture discusses having the executive director of the local governing entities hire, fire, those things by the Surgeon General. That was modified to talk about the LDH as opposed to the Surgeon General. And then it would establish a council or a committee that would serve to advise the local governing entities. So I don't know that I have a ton to say about that, but where it landed after a committee yesterday was that there was still a lot of work that needed to be done. Some of the legislators talked about how active their local governing entity was. Some of the legislators talked about they didn't know what their local governing entities did and didn't know the executive directors or have a relationship. So it seemed like there was a lot of conversation. There were some of the executive directors there who talked about the oversight that LDH does have for the local governing entities in the form of the contract, and they get audits from the Louisiana legislative auditors. I think where it landed was that while it seems to be working in some areas, it doesn't seem to be working in other areas, and there's a need to do better in some way. So they will be back next Thursday, back in House Health and Welfare to continue the conversation. It sounded like there will be some meetings between yesterday and next Thursday around the bill. There was some testimony given about specific to DD services and OCDD needing to have some additional oversight for the local governing entities. So I don't know if there's questions, happy to take questions if I can answer them, but the bill did not originate from LDH, so typically LDH has to take a neutral position. So I'm not able, you could ask me about any bill and I wouldn't be able to tell you I'm for or against it, because we have to have a neutral posture. But there are bills that we do decide, like LDH kind of sponsors the bills. And so we call it an LDH bill if we go ask to do something or change something that has to do with our services. This was not a bill that was sponsored by LDH or that came from LDH staff to do. So we're neutral on the bill as we are with other bills. So that's when I say I don't have a lot to say, or I can't really tell you I'm for or against, or, if if a bill goes through and passes, we will do what we need to in order to implement the actions in that bill. But I don't know if there were specific questions around what the bill says right now, or what's currently happening with the discussion.
I guess for me, it's not a specific question, but like some of the things that I had thought was in the bill is like this council that it creates, there's a lot of representation on this council, but is no one with a disability, no one that utilizes any of the services. I think it essentially, does away with the board at the LGE level. I mean, if you have no appointing authority, you really have no authority, right? Because this director is answering to someone else. I do think if it's a topic that was interesting though, for you to go back and watch it, if you did not watch the discussion, especially if you interact a lot with your LGE in your region, to find out maybe if that was one of the LGEs that they discussed of not doing well or doing well. But it is, at least based on that committee meeting, from my viewpoint, the LGEs, I think, are very polarizing in the legislature. It's a love them or hate them kind of situation. So I think if that is something you want to discuss and advocate for, I mean, I would encourage you to reach out on behalf of your LGE, whether it's good or bad, whatever your opinions are. I was also kind of concerned to hear, at least my takeaway from the representative that is running that bill, Eccles. I don't get the impression he spoke with any of the LGEs prior to doing this bill, which I think is concerning. If you have a problem with someone, you should probably include them in the discussions. So that was just some of my takeaways from watching it yesterday, of some of the concerns that I had there.
Any other questions or comments?
Okay, that concludes my update.
Okay, thank you, Julie, for those updates. Oh, any questions before we move on? Okay, now we'll move on to our contractual activities. Stephanie, would you like to start us off?
I'll start with, partners and policy meeting. Of the 24 applicants were accepted into the 2025 partners and policy making class. 20 completed the January session, beginning the program. As of the March session, all 20 participants are expected to graduate from the program in June. 3 sessions took place in this quarter, which were in January, February, and March. So I'm already on here. The speakers for the January were Ebony, Haven, Jamie. I'm not gonna say this right. Thank you. And Guy Caruso. In February, the speaker was Deborah Whitfield, and in the 3rd session, it was on inclusive education and post-secondary education. There were a lot of speakers on. The keynote speaker was Patrick Schwartz, Dr. Mary Grove with LaPi, Dr. Francis Wang with Touchstone PTA, Nicole Stajon with YLF, Nicole Flores with FHF, and Tori Roca with Disability Rights, and a 5th graduate, Dr. Brooke Osborne. That is what I have for partners in policy making. Please don't ask me any questions because Hannah is not here. And she is the one to know. I'm just reading her notes. And then I'll also give you an update on YLF, our Youth Leadership Forum. So YLF received a total of 25 delegate applications, 10 applications have been confirmed and others are in the interview process. 12 staff members have been interviewed and selected for 2025. The next step is that the staff will begin training in preparation for YLF. The coordinator and staff are continuing their planning for the forum in July.
I have a question.
I can try to answer it.
Wait, sorry. They're not impacted by like the hiring freeze or anything like YLF's.
They
Closed
are,
down.
These are all contracts of ours.
Okay, so they're,
not impacted by that. They would be impacted by our funding.
okay,
But YLF also has funding from other sources too, outside of just.
okay.
I don't know, I know last year, I know the first year that they did it, the staff were volunteers.
Oh,
The second year, I believe they received a small stipend. I'm not sure what the plan is for this.
okay.
When is it?
The YLF will be held July 10th through 13th at Louisiana State University at Eunice. So LSUB.
Oh, you know. Wait, are we gonna go, do we do the abuse, neglect, and exploitation training?
Yeah, so that'll be Stephanie's still, yeah. She was giving you Hannah's updates since Hannah's
Oh,
out.
yeah, I'm so
But
sorry.
you have
Yeah.
your actual.
Let me grab my notes. And
I was like,
right now, so sorry. Okay. Thank you, sorry, bro.
no problem.
I got stuff there. All right, so moving on to the abuse, neglect and exploitation training. So the council is collaborating with OCDD and partnering with Team Dynamics to provide the education and awareness around abuse and neglect of individuals with intellectual and developmental disabilities. So there will be 9 statewide trainings on January 28th, the council sent out an LADDC news for stakeholder feedback on recognizing and responding to abuse and neglect within the disability community. Using the feedback from the stakeholders, which they received 160 responses, they created the training for the state. And all 9 trainings have been scheduled. The first 2, and I say it, the way that they have it is kind of by region, so they're doing 2 in one day that are close to each other. So they will be, one will be in Alexandria and one will be in Lafayette on May 13th. And I will send out probably next week or this coming week, just a reminder for registering, but I did send out one that had all of the dates and the locations and the registration links for that one. Were there any questions for that? That's all I had.
Okay, thanks, Stephanie. No questions? And none in the chat? Okay, Rakisha, will you give us an update on your activities?
Yes, ma'am. The first activity is with CAN. Just to give a few updates on the CAN. We currently have over 6,840 individuals registered for the council. and the can was served to receive information and action alerts related to home and community-based services, employment, education, and early intervention. There have been a total of 7 action alerts and 744 actions have been taken. We've had 4 yellow surveys with about 77 people in attendance. The candidates are in the process of scheduling and completing formal legislative visits with key committee members to discuss this year's advocacy agenda. So far, our leaders have supported members in 30 formal legislative visits, in which 16 of those visits were with key committee members. Since our last council meeting, we've had 9 virtual legislative roundtables across the state with about 316 participants in attendance. That's 18 self-advocates, 116 family members, 140 professionals, and about 13 policymakers. Any questions or concerns about my opinion? All right, I can move on to the next one, which is Families Helping Families. With Families Helping Families, the centers have assisted 24,277 individuals with disabilities and families with information referral, peer-to-peer, and other supports. There have been over 32,862 units of information and referrals completed, with 155 trainings conducted in 2,800 with individuals in attendance. Centers have also conducted 170 outreach activities to hospitals, pediatricians, school districts, and applied behavior analysts, clinics, and physical therapy. And you guys should have a chart inside your packet to kind of give you a breakdown. Just a reminder that this information is not updated as of today, but these dates were most accurate to when the chart was made on the 10th of this month. So some of those numbers might change for your next council meeting. All right, so for the next one, any questions about Families Helping Families? The next one is our total occurring disorders. All right, for this one, just to remind you guys that the council collaborated with the article to conduct 1 web-based training for professionals statewide and 10 statewide trainings. That's 9 in person, 1 web-based to individuals with intellectual and developmental disabilities and co-occurring behavioral health conditions along with their families. These trainings serve as an opportunity to raise awareness about healthcare disparities through training opportunities. Since our last quarter, they've had 3 in-person trainings and they've had about 20 participants in attendance. The training information will be shared as scheduled with all FHS centers, People First of Louisiana, Disability Rights of Louisiana, and we will continue to promote the trainings as scheduled. Adults with disabilities, their families, and others of interest, as far as organizations and stakeholders, are always encouraged to attend. So the last one I have is our fetal alcohol syndrome. It's the fetal alcohol spectrum disorder. To remind you guys about this contract we have, the council collaborated with LSU Human Developmental Center to create and conduct an outreach campaign to increase fetal alcohol spectrum disorder awareness and or the prevention to communities statewide. The council also collaborated with LSU to conduct training for at least 100 social workers within 9 Louisiana DCFS regions and at least 50 foster or adoptive parents within 10 Louisiana Families Helping Families regions. Since last quarter, LSU Human Development Center continues to plan for the distribution of the awareness posters for the fetal alcohol spectrum disorder statewide. They received guidance from Healthy Child Manitoba to create an online awareness survey for the state of Louisiana. And they've also collaborated with the Department of Children and Family Services staff to reschedule the social worker and foster parent trainings. 2 trainings have been held this quarter with about 26 people in attendance. That's all I have for you. Any questions? One hand raised.
Ms. Brenda Jose. Ms. Brenda Jose, you can unmute.
Hello.
Hi, Mary. Yes, we can hear you.
Hello.
Hi, Ms. Brenda.
Hi. Can you go back to the screen that had the TBAs? All the TBAs. It's kind of going fast. Who was that with the TBAs?
Oh, that's the training for co-occurring disorders.
Who was it?
That's the co-occurring disorders. That's the trainings for them. So the to be announced is because they have not scheduled the trainings with DCFS just yet. So they're still in the process of trying to come up with a schedule.
I can go ahead.
But once they pick dates, they always send it to us. And we post it on our website.
Okay, and who that was? I'm sorry, I'm visual. Who was that?
It's the ARC, right?
Yeah, I think you mentioned that. Oh, yeah, it's the ARC of Louisiana, I'm sorry. You have any other questions, Ms. Brenda?
Oh, okay, I see it now. Thank you so much. So it's not based on whether or not they get enough participation in the previous trainings. That's my question.
No, ma'am.
Okay, thank y'all so much.
You're welcome.
Yes, Jill.
Okay. I've got a question, Keisha.
Yes, ma'am.
So the 3 trainees you said we'll admit for the 29th, the 25th, and the 16th, correct?
Yes.
So for this April 16th, do you have the number yet?
Now, so when this form was created, you see at the bottom, my little footnote tells you that this form was done again. So we do have the numbers, I just don't have them listed on here, but I can get it to you, today, but you'll definitely have it next quarters.
Okay, I was just curious. Thank you.
No problem.
Okay, thank you, Rakisha. Does anyone have any other questions? All right, please note this meeting, after this meeting, please note after this meeting, our Act 378 committee meeting will be held in this room starting at 2:45, followed by the Education and Employment Committee meeting. Also, tomorrow is the full council meeting, which will start at 10 a.m.
The chair for that is me.
Who is it? It's not me. It will also be in the same room. Those that have registered to participate virtually should have the links to the meeting in their email. Does anyone on the committee have any other announcements to make? Okay. Do we have anyone wishing to share public comment? Oh, yes.
I just wanted to remind, I know we said it in the executive committee, but in case you weren't here, the LADC news that we sent out, it's called Share Your Story. I know that that is one of the things that we were talking about that is most powerful, that Julie was talking about, sharing your story to the legislators. We are looking for impact statements in order to share them with our legislators and our annual report. Yes, I couldn't remember that word either. For our annual report. So if you can, share that and, you know, just be aware that it is 1 hour. It's listed on our website. We sent it through the LADC news, and we also put it on social media, so, just sharing that far and wide with your friends or anybody that you know that has benefited from the DD Council and their activities.
Thank you, Stephanie. If no other comment, I hereby adjourn the meeting at 1:53.